Investors are looking for is they want their cake and they want to eat it too. They basically want high returns and low risk. They want that Madoff Ponzi scheme, except they don't want it to be a Ponzi scheme. They want it to be the real thing. And let me give you a very clear example to make it absolutely explicit. If I ask you to make a decision, a financial decision, to choose between investing in a marginally effective cancer drug, it basically provides an extra 30 days of life expectancy. And that cancer drug is currently in phase 3 trials. And if it gets approved, it will be sold and marketed as a successful cancer therapy. That's one investment. The second investment is a gene therapy for curing Alzheimer's disease, a disease where, by the way, we have not had an approved drug in about 15 years. The last approved Alzheimer's drug was in 2003, and that didn't even modify the disease. That just dealt with some of the symptoms of Alzheimer's. Which would you invest in? How many of you would invest in the Me Too cancer drug? Yeah, that's the right business decision. But it's not the right decision for patients necessarily, or for society. And this was brought home to me in a very personal way several years ago when my mother was battling non-small cell lung cancer. I was introduced to a very successful biotech company that was developing a number of experimental therapies for lung cancer. And I was privileged to meet with the chief scientific officer. He had no idea who I was, so he brought along his chief financial officer, who actually did hear of me and used one of my textbooks as an MBA. And I talked to the two of them, and I asked them what I thought was an innocent question. I asked them, does your source of financing have any influence on your scientific agenda? Because, of course, I was deeply interested in trying to see whether or not the particular therapy that might help my mother could be moved up in the priority rankings of their scientific agenda. The chief scientific officer looked at his CFO knowingly, shook his head, and turned back to me and said, influence? Our source of financing drives our scientific agenda. It drives it. Now, as an economist, I understand you got to pay for things. But as the son of a patient, I was absolutely outraged, because what does stock market volatility, interest rates, and Fed policy have to do with whether you should treat cancer via immunotherapy or angiogenesis inhibition? Nothing. But it drives their scientific agenda. Now, I'm not a biomedical expert by any means, but shouldn't the science be driving the financing? Haven't we got it backwards? And I think that's part of the problem.